Paul Lavoie, Radio Central News Network.
Has joined the conference.
Welcome, everyone. Starting on time here today. Want to welcome the press and, of course, our Mohave County residents who are tuning in as well. I'm Roger Galloway. I'm the Mohave County Communications Director. Our subject, of course, is the coronavirus COVID-19. In a few minutes, I'm going to be calling on our individuals from the media to ask questions. I'll call on specifically outlets first, very specific ones. Each of you can ask a question, and then you will have a follow-up as well. I'll then ask others to identify themselves and the outlet being represented, and you can come in with your question and ask whoever you want that's up here. Please mute your phones when you're not speaking. That's very important. If you can't be heard properly on our speakers, you can text me and I'll read your questions. I think most of you have my phone number by now. Most of you have that cell number. If there is a problem, please just let me know. This is a very important news conference, and we don't have these unless there's a need. We're going to be turning first to our Mohave County Health Director, Denise Burley, then to our County Supervisor, who is Chairman Gene Bishop, and Supervisor Gary Watson. We have someone else that's going to be coming on, I believe, on the telephone and representing another entity in just a moment. In the meantime, let's turn immediately for some very important, vitally important news from Denise Burley, our Mohave County Health Director. Denise.
Thank you. Good afternoon, and thank you again for joining us. We wanted to inform you that we have a second confirmed COVID-19 case in Mohave County, and that case is in the Bullhead City area. The individual is an adult, not hospitalized at this time, and recovering at home. Our nursing staff will be working with this individual to identify contacts and reach out to those contacts and have them closely monitor for symptoms, and if need be, quarantine for 14 days based on the risk of exposure.
Is that your statement for right now? I just don't want to move on until I'm...
Yes.
All right. We'll turn to, and of course the press will be able to ask any questions that they want following our three representatives up here. Gene Bishop, our chairman of the Mohave County Board of Supervisors. Gene.
Good afternoon, everybody. As you just heard Denise explain, Mohave County now joins other counties in Arizona with 2 confirmed positive cases of the COVID-19 virus. That triggers the governor's executive order limiting the operations of certain businesses to slow the spread of this virus. So effective immediately, all bars, movie theaters, and indoor gyms and fitness clubs must close. Access to the public and all restaurants shall close access to on-site dining. Restaurants may continue serving the public through pickup, delivery, and drive-through operations, and Executive Order 2020-09 also affects the purchase of alcohol. Executive Order 2020-12, that prohibits local governments from closing essential services. According to this executive order, Mohave County is prohibited from making or issuing any order, rule, or regulation that restricts or prohibits any person from performing any function designated by the governor, the director of the Arizona Department of Health Services, or the Division of Emergency Management as an essential function. An essential function is defined as one specifically identified as such, or a function that promotes the public health, the safety, and the welfare of the state, or assists others in fulfilling such functions as outlined. These restrictions are mandated by our governor and will be strictly enforced. We are a strong, determined, and committed county, and we are in this together, and we're going to get through this together. Thank you, Roger.
All right. And Supervisor Watson, Gary Watson.
Thank you, Roger. I really have nothing to add to the two comments by these fine ladies. If you have questions directed to the executive orders, I'm prepared to answer some of those questions.
All right. I know we're going to have questions from the media. Just before that, I believe we have with us on the phone the Mohave Community College President, Stacy Klippenstein. Sir, do you have a statement as well?
Roger, I really have nothing to add to
Yes, thank you very much. I hope you can hear me okay. Can you hear me?
Yes, I believe so. Yes.
Okay, great. Thank you all very much, and I appreciate the work that the county has done, as well as our partners in the health professions in dealing with this situation. As many people know, that Mohave Community College was on spring break last week, and that also meant that all of our faculty and staff were gone because we were completely closed. On March 13th, we did provide information that Mohave Community College would extend spring break for students for one additional week, allowing faculty to come back and prepare any online courses into an on-site courses into an online format to prohibit or limit the amount of face-to-face exposure. Our faculty are back this week working diligently on that and are communicating with our students. So on Monday, March 30th, they are prepared to continue their coursework in the best safe manner as possible. We also have closed all or canceled or postponed all community ed courses and events on our campus. Our libraries, which most will have limited hours, so we have computer access to students, will remain closed to the public during this time, so allowing a better, safe environment for some employees that will be there as well as students. Of course, we will continue to practice social distancing and other best practices as recommended by the CDC. At this time, we will continue to monitor on a daily basis any situation that occurs where we feel like we might need to go to a more complete non-face-to-face format, therefore closing all institutions for the time being. But at this given time, we're trying to do everything we can to accommodate students in labs and current technical programs in completing this semester. Again, we will continue to communicate with our students, our faculty, staff, and communities regarding the work that we're attempting to do to support the safety of our faculty, staff, and students. And I'll stand for any questions when the time is necessary. Thank you.
All right. Thank you, sir. Thank you very much. All right. Let's turn to our media for any questions that they might have. And we'll start off again with the Lake Havasu City Herald.
This is Michael Zog. Can you tell us whether either of the positive tests are attributed to travel or community spread?
So at this point, we don't have any reason to believe it was contracted during any group events in Mohave County, but we're continuing to investigate these cases.
Any questions that they might have? And we'll start off again with...
And I guess my follow-up, why the county not releasing demographic information and stuff like that as officials have in other areas?
Thank you for asking that question. You know, in all cases, doesn't matter which county you're in, we take direction from our providers and patients on what they authorize us to share. And in this case, the information that's been provided to the media and to the public is what we have been authorized to share.
The county not releasing demographic information.
All right. Can we turn to... we have someone on board from the Kingman Miner.
Yes, Aga Popanda here from the Miner. My question is how the enforcement of restrictions on local businesses will look like, how they will be enforced.
How will they enforce in the different communities, the bars being shut down, etc., right?
Yes. How the restrictions that are currently placed on local businesses, such as restaurants and bars, will be actually enforced, meaning how they will be monitored and checked if people obey.
I didn't hear the second part of the question.
I didn't hear all of the question, Aga, but I believe your main concern is how are these restrictions going to be enforced by Mohave County? And, you know, as I mentioned in my initial opening was that we're in this together, and we would expect that the public would see things and say something so that we can investigate further. Obviously, we don't have the manpower or the staff to go out and physically police and enforce the entire Mohave County, the 5th largest county in the nation. So we're going to ask the public to please help us on that.
What about the Mohave Daily News? Do you have a question? All right. Let's turn to Radio Central.
Yeah, thanks, Roger, and thanks for the invitation once again. I'm not sure who this question is for, but now that, by my count anyway, 12 of the 15 Arizona counties have confirmed cases, is there a threshold at which the governor says, okay, there's a stay-at-home order like we have in New York or California? All right.
Wow, that's another good question, for sure. The governor has not indicated to public health that there's a threshold for that, and I don't know if that's been shared with public leaders. So I think it's up to the governor to make that decision, and that'll be probably in consultation with the Arizona Department of Health Services staff and other leadership within the departments that are addressing this issue.
Thanks, Denise. That being said, how many unconfirmed cases or how many tests are out there that we don't know if it's positive or negative?
Are you referring to just Mohave County?
Suspected, yes. I'm sorry, in Mohave County.
That's okay, yeah. So I don't have an exact number for you, but I can get that information to you all after this press conference. I think I can have a fairly close to approximate number.
Is it bigger than a bread box? Is there a number over 50, over 100? Can you tell me?
Well, definitely over 50, and I would say somewhere between 70 and 100. But that's...
Okay, thank you.
Mm-hmm, certainly.
All right, let's see, do we have Dave Hawkins on board? If so, would you like to ask a question?
I think I can have a really close to approximate number.
The Rattler.
Is there a number over 50, over 100? Can you tell me?
All right, is someone on the line right now would like to ask a question? Step forward. Go ahead.
70 and 100.
This is Michael Zog. I guess we're getting calls from people, wondering if they've been in contact with the patient, at the grocery store or things like that. What would you say to people who are worried that they may have come in contact?
Well, public health is concerned about close contacts. And so for those individuals that have tested positive or that are suspect cases, they're pending results, those people have been asked to self-isolate for the time being and await their results. And then if they are positive cases moving forward, we would reach out to the contacts of those individuals, those people that have been closely around them for a period of time, to have those individuals, as I mentioned before, monitor their symptoms, and if need be, they can self-quarantine or self-isolate for the 14 days, and certainly reach out to us if they have any questions.
All right, we have another question.
Yes, here in the News Herald.
And a message for today's Herald. Can you tell me, is there the majority of jobs here in Mohave County are either in the service or hospitality industry? What impact is the governor's order going to have on Mohave County's long-term economy?
I didn't clearly hear the question.
You want to repeat that, please, one more time?
All right. Is there an estimated impact that this is going to have on Mohave County's economy?
Okay, the impact on Mohave County's economy, it's not known at this time, and I believe it's going to have a serious impact, but how serious that's going to be or how much, there's not been any numbers or any estimates placed on that.
I have a question texted over. What is the line between simply stocking up and being prepared and hoarding?
I can certainly take that. I mean, your activities that you would normally take when you go to the grocery store. I think most people shop for a week at a time. If they live in one of the outlying areas like Dolan Springs or Meadview, they may shop for a couple weeks at a time. But hoarding, in my opinion, would be stocking up for a month or 6 months, or in some cases buying supplies that you think might be limited in time, like the toilet paper issue or this hand sanitizer. So hoarding would be just buying more supplies than what your family can use in a week or 2 weeks, which is a normal time span.
All
That's
right.
my opinion anyway.
See, we have a question here from Dave Hawkins. It's for Denise. How challenging and staff intensive is it to trace contacts of the 2 infected people, and does the state or CDC help you?
It can be very time intensive to track the contacts down of these individuals, and in large part it depends upon the circle of that individual and their involvement out in the community or with family and friends. And so it's very dependent on the case, and it could be from just a few people to 50 or larger. It depends on that particular case and that particular patient. At this point, we don't have any assistance from CDC to do any interview work with us, and or even with from ADHS. So we are working tirelessly to try to get that completed, because I think all involved want to see that happen as quickly as possible, and we'll address every case in that same manner to the degree that we can.
We have a question from Aga from the Kingman Minor. What about small businesses like hair salons? Will they remain open? Do we know about specific businesses like that?
I think that would be in the list of what the governor's put out as essential services, and I don't believe a hair salon would fall in any category that's been listed in the governor's list.
We have a question from Paul Lavoie. If the president of Mohave Community College is still on board with us here. Sir, are you there?
Yes, I am.
Okay. Paul, what is your question, please?
Yeah, Dr. Klippenstein, obviously several or numerous students will be impacted by this regarding graduation and receiving technical certificates and training towards those goals. What is the school doing to help those students?
Well, we're trying to do everything we possibly can at this time to keep all of the courses intact, to be able to help them complete at the end of the semester, which ends on roughly May 14th. So we're trying to do everything we can to move on-site classes to online. Of course, all our online classes right now will remain as is. And anything dealing with labs or current technical where they have to come in and do, let's say, testing and welding, we're trying to work that out with our welding instructors on social distancing, on being able to come in at different times to be able to perform those. Of course, as this continues to grow as an issue and concern, we will evaluate moving forward to a non-face-to-face format. And can we complete the semester earlier? But we have every intent to try to help students get through this semester and complete this semester, and then we'll evaluate summer school and summer schedules.
Thank you, sir.
Thank you.
We have this question concerning enforcement. What is the enforcement action or penalty, if anyone knows, against establishments that simply refuse to follow the direction to close?
I think I haven't really thought that one out. I started to say I think, but I I'm sure there would be a notice of violation letter sent by probably the Department of Public Health. And Supervisor Watson, can you help me out on this one? Besides a notice of violation letter and...
I certainly try to help you out, Chairman. What we're looking for is voluntary compliance. And voluntary compliance is simply thinking about saving the lives of loved ones that you may be in contact with, the ones in your family, those loved ones that you have in contact on a daily basis, and those folks that could even be your customers. As far as having any policing authority, I'm sure that there will be at some point in time, if this continues to be a critical situation, that there may be some inspections, but I really doubt that. We're looking for voluntary compliance. At this time, nobody's going to come beating down your door if you're not in that mode. But we are appealing to use your common sense, common dignity, and voluntary compliance.
Very well put. And in fact, I have a printout here from FEMA, and to date, over 369,000 tests have been performed for the COVID-19 in state and local public health and commercial laboratories throughout the United States. And they say that approximately 10% of the individuals test positive for this coronavirus. So we would hope that our residents would be looking out for each other, and as Supervisor Watson said, kind of police each other and do what's good for your family and your neighbors.
All right, Supervisor Bishop, Paul Lavoie has another question for you.
Okay.
I'm hoping this question is for you. On the public affairs show that I host, a listener today asked about price gouging and who he would report to. I've also had listeners who have contacted me on social media asking the same question, and we weren't sure. The BBB was the best I knew, but can the county enforce, are there any enforcement actions against businesses that price gouge?
I believe the governor put out an executive order that deals with price gouging, and I saw that on my computer just this morning, and I haven't actually read it. I don't know if there's any actions that would be taken as a result of that, but it is certainly frowned upon, and as far as on the county level, I don't know that we'll be taking any actions.
We have any other questions from the media? If you do, go ahead.
Yeah, Roger, Paul Boy. This would be for Denise. Can you tell me you may have addressed this already, but the ages of the two confirmed cases, and if there are any underlying health issues?
In these cases, I'm unable to share that information. And as I mentioned before, we receive permission from providers and patients to share information, and in both of these cases, we have not been authorized to share any more than what's been provided in the press releases.
Okay, so with that said, does HIPAA not apply here? Because I don't think that would be a HIPAA violation, would it?
We respect the privacy rights of those individuals, and so they basically own their health data and can share what they wish. And in this case, this is what they've chosen to share.
I see. Thank you.
Certainly.
Any other questions?
Roger?
Yes.
Roger? Bill McMillan from the Mohave Daily News.
Yes, sir.
Has the county considered superseding the governor's orders and targeting any other businesses that need to be changing in their operations?
We have not.
Roger?
Yes, go ahead, please.
Sorry, Paul Lavoie again, Radio Central News Network. What do you say to those people who may be ill but don't have insurance and won't go to a doctor? How would you advise those people? I don't know who wants to answer that question.
I would encourage them to stay home until their fever, if they have a fever, until 72 hours after the fever is resolved without medicine, and the other symptoms have resolved as well, so they no longer have those symptoms.
All right, do we have... go ahead.
Is that 72-hour time frame common? I hadn't heard that.
So those are the CDC recommendations specifically for COVID-19, but also looking at, if you were looking at other illnesses with fevers, you definitely want to make sure that your fever is resolved. But for COVID-19 potential cases or people who might think that they've been close to a contact, it's 72 hours after your fever has broken without medicine, and then making sure that all of your other symptoms have been resolved by that point as well, before returning to work or before going back out into the community.
So could I follow up?
Thank you so much.
Mm-hmm.
Do we have any questions?
Could I follow up on that question? Because here in Kingman Regional Medical Center does have a program where you can call in and speak to a medical professional, and they're waiving any fees for this time period. So I don't know how long that'll last, but from what I've read, is they're offering that to the general public at no charge for now, and you don't have to have insurance in order to call in and get some advice over the phone. So other communities might want to check with their local hospital and see if there's anything like that being offered.
Yeah, and to add to that, it's KRMC's Care Anywhere program, which you can access through their website. And then the health department also has a call center to try to answer some general questions. And then there's also a state Arizona coronavirus hotline where people can call and get questions answered as well, and I can provide that information if you'd like. The phone number for the Arizona coronavirus hotline is 1-844-542-8201. For general questions, if you'd like them to contact the health department, the number is 928-735-8665. And you can access the Care Anywhere telemedicine program through the KRMC webpage.
All right. Do we have any questions from anyone else in the media besides the erstwhile Mr. Lavoie?
Hi, this is Catherine Fitzgerald from the Arizona Republic. I was wondering, is there any heightened concern about having community spread from if there was higher tourism lately with spring break and people around the area? Is there heightened concern about that?
I don't. We have 2 cases in our county. We have a number of tests pending and awaiting results. And I think in those cases, having that many pending results certainly puts people on edge and causes angst and concern. And, as far as community spread, I think that because we are surrounded and the numbers are growing around us, I think we recognize that there could be additional cases in our county, and we want people to take those precautionary steps to ensure their neighbors are safe, they're safe, and they're able to stay healthy. And so we can talk more about those as well, but I think we've done quite a bit of education around some of those preventive measures.
Yes, sir. Supervisor Watson.
Thank you, Roger. Yesterday afternoon, I was speaking with Amanda Dotson from the Bureau of Land Management, and she was concerned about the possibility of a number of people coming to the Mohave County public lands to be dry camping. And with the discussion with her, we kind of tossed around a number of ideas. And when you're dry camping with a number of large people, we recommend that that you put your camper or your motorhome or whatever device that you're using to camp out with at least 50 to 100 feet away from your neighbor. Use common sense and try not to have any gatherings, obviously, people outside your family. Certainly, I'm sure you want to visit and wave to those neighbors and whatnot, but we do have a little bit of concern that those people coming from other states may be using our public lands, and we're asking that they use common sense and park their vehicles and camping equipment to be at least 50 feet, if not further, apart from from your neighbor. Just common sense. Thank you.
Thank you. Any other questions from the media?
Brandon Messick with today's News Herald. This question is for Denise Burley. We can be reasonably sure that more cases confirmed are coming. What can we reasonably expect by week's end?
How many cases do you expect might pop up by week's end?
I see. You know, that's very difficult to say at this point, and I hesitate to speculate on any of that because we're awaiting these test results. And while we know we have a lot of outstanding and pending cases, we're unsure of the time frame that we'll receive those results in. And so it would be pure speculation on my part, and I prefer not to go down that road. But, you know, we will be very open and clear and notify the public as we get results, so that way the public is aware of the numbers. In which case, I'd also like to share that on our website we have, you may notice that on our website it says 0. What happens is that we have, our website is tied to the state website for the number of cases, and they sort of have a cutoff of 5:00 p.m. the day before, of which case we were not notified of our cases now until after that time. So tomorrow you should see updated information and accurate case numbers. So we just want to make sure the public is clear when they see that there's a delay there that we have little control over, but we want to make sure we're getting accurate information out to the public.
All right, thank you. Any other questions, please, as we come to a close?
How will future cases be announced? Is it all through press conferences, or can we expect press releases?
I anticipate that you'll receive it through press releases, but we also want to be open to doing these press conferences so you have an opportunity to ask questions.
Thank you.
All right, thank you. Would either of the two supervisors like to add anything else at the close here? And then I'm going to turn to Denise Burley.
Thank you, Roger. Just want to let everybody know that Mohave County elected officials are working together with the local, state, and federal officials to ensure the safety of our residents and our public health. It's very imperative now that we all follow these COVID-19 guidelines to safeguard the health of our communities. And I'd like to ask everybody to do their part to help stop the spread of disinformation. And you could do that by doing just 3 simple things. Number 1 is don't believe the rumors that are out there. And if you read rumors, please don't pass them along. And last and final is go to trusted sources for your information. If you hear or see things that you question, please go to a source that's trusted, like the CDC or the state or the county sources, and get information that's true and stop these rumors, because the rumors are almost as bad as the virus itself. So thank you very much for allowing me to be here, and thank you, Denise.
All right, we turn to the final statement with Denise Burley, our health director.
Wonderful, thank you. What I want to do is just encourage everyone to follow the preventative measures that we've outlined in the past. So those include avoiding close contact with sick individuals, avoid touching your eyes, nose, and mouth, stay home when you are sick, cover your cough or sneeze with a tissue, then throw the tissue away immediately, clean and disinfect surfaces and frequently used or touched objects with disinfectant sprays or wipes. Wash your hands often with soap and water for at least 20 seconds. Of course, you're going to sing the happy birthday song twice or something close. Use alcohol-based hand sanitizers if water and soap are not available. And practice the social distancing, approximately 6 feet apart. And by taking these steps, we have the ability as individuals and as a community to reduce and minimize the impact of COVID-19 on our county.
All right, thank you. Just a final closing. My cell phone itself is a good example of something I sometimes place on counters and things like that. Everybody has one, so I try to keep it clean. And also, after you get gas, oh boy, with those gas pumps and putting in your your PIN number, etc. Just one final thing. Don't forget mohavecounty.us. We put up the latest news there. You can go to that site and see the press releases at any time. And also, the very link that brought you here right now is going to, as soon as we finish here, it's all recorded and it will stay up. So if you want to share this to other people later, you're free to do it. Thank you very much for coming here with us this afternoon for what I think is a very important press conference. We'll see you soon. Take care.